This is going to be topic 51.4, environmental water emergencies.
Key concepts. Upon completion of this chapter, you'll understand the epidemiology of drowning, pathophysiology of drowning, disorders of dysbarism, decompression illness, treatment of the drowning patient. Quick overview. Over 20 definitions as far as drowning goes: near drowning, wet drowning, dry drowning, active drowning, passive drowning, silent drowning. Standard definition is as such: any submersion that results in a primary respiratory impairment in a liquid medium. Greatest danger are residential swimming pools. A water emergency. First thought, is there a drowning? Drowning is a complex topic. Freshwater versus saltwater drowning, swimming versus diving emergencies, complications of cardiac arrest. In wet drowning, lungs contain at least some liquid. However, the patient will more likely become negatively buoyant, which means that they're going to sink. A dry drowning, patient asphyxiates. Lungs stay dry. The patient may be positively buoyant or floating as air remains in the lungs. Fresh versus salt water. Electrolyte imbalances occur as water enters the bloodstream, thus leading to dilution of electrolytes. Small amounts of aspiration of either salt or fresh water rarely leads to any serious electrolyte imbalances. Risk factors of drowning. The greatest risk is youth. 1 in 4 drowning patients is a child under 15 years of age. Complications of hypothermia. Common complications. For the human body to stay in water for a prolonged period of time, the water must be warmer than 91 degrees Fahrenheit, or thermally neutral water. The majority of fresh water in the United States is usually less than 77 degrees Fahrenheit year-round. Cold water reflex. When the human body is suddenly exposed to cold water, the body's defense is to immediately shut down all but the vital organs or shunt to the core. Dive drowning. Diving types: sport or commercial venture. There's various things: free diving or scuba diving without any apparatus, using breath holding. In scuba, diving with a self-contained underwater breathing apparatus. Diving down, a special subset of water emergencies, usually secondary to equipment failure, problems with the air supply, or medical emergencies while submerged. Seizures, sudden cardiac death while under the water. And then shallow water blackout. Patient passes out of free diving or snorkeling due to hyperventilation and subsequent hypocapnia prior to swimming. Dysbarisms. Disorders resulting from pressure changes, high altitudes, ascending or descending underwater, consists of decompression sickness, arterial gas embolus, and then barotraumas. We're going to talk a little bit here about gas laws. This is a brief overview. Boyle's law, and there's always a Boyle's bubble burst. And when a gas is placed under pressure, assuming a constant temperature, the volume of the gas will change inversely to the changes in pressure. The greater the pressure, the smaller amount of volume. The lesser the pressure, the larger amount of volume. So this is Boyle. So if we had a balloon, and we took off, and we're going to go in altitude on this. It's easier to explain. The higher that you go, the less pressure. The lower that you go, the higher amount of pressure. So if this balloon was in an airplane that had an unpressurized cabin, and it took off at sea level, by the time that it got to 10,000 foot, the same balloon because of less pressure caused gas expansion. Now, clear all this off of here for a second. And conversely, if you started off with a balloon this size at sea level and then dove, like 2 or 3 atmospheres, about 60 to 90 feet, the pressure exerted, because the pressure would increase, would decrease the size of the balloon, because of the volume of air inside of it at sea level was pretty much a constant. However, as you apply more external pressure, the gas has a smaller volume. It's more compressed. Dalton's law. And we talked about Dalton's law in one of the previous chapters. I'll talk about it again. Dalton's law is the sum of the parts. Dalton's gang. So essentially, our atmosphere is a summary or a total. It's like a slice of pie. So oxygen, nitrogen would be a big, all this area here colored in would be nitrogen. Now, anything gets into this pie that will displace the rest of the gases, and it decreases also the amount of oxygen that is present in the sample. So Dalton's law, if pressure is exerted on a mixture of gases, and that's what our atmosphere is, the individual gases will all compress the same, and the proportion of the pressures will all remain constant. So even though we have a volume that was once like this, if we dive, it's under the volume decreases because of the increased pressure on it. But still, if we tested that sample, 21% of it, my apologies, 21% would still be oxygen. Henry's law, or like I like to refer to it, Henry's hangover. Henry's law, the amount of gas dissolved into blood and tissues is proportional to the partial pressures of that gas. So depending on the partial pressures of these gases, they will exert more force when being released. An example of this is champagne or a soda. That the compressed CO2, carbon dioxide, was placed into a fluid solution. And now, once you open up the cap on it, the CO2 escapes. That's because it is off-gassing. Well, the same thing can occur in your system, or off-gassing, if you will. And Charles' law. Charles' law deals with changes in temperatures, or Charles Celsius. Now, what Charles' law says is if you heat something up, it'll expand. Or if you cool it down, the volume will decrease. And that's because of, and I'll read you the law here, if the volume is held constant, the pressure will decrease proportionally to the decrease in temperature. If the pressure is held constant, the volume will decrease with a decrease in temperature. Quick review of gas laws here. Alright, decompression illness. Very broad umbrella. Air-filled spaces like the lung and intestine, anything that might have air in them can give us problems. Decompression sickness. Example, patent foramen ovale. Heart septal wall opening closes but does not close completely. It often gives us an innocent murmur. This may be a problem at the point that we have decompression sickness. Chokes, pulmonary decompression sickness, pulmonary gas emboli form, expansion of gas rapidly from a near liquid form or a compressed form can give us problems if it hits one of our organ systems. Immersion pulmonary edema, thought to be due to immersion in cold water. Peripheral blood is redistributed to the core. The peripheral vasoconstriction increases peripheral vascular resistance, increasing the heart's workload. Throws them into pump failure. Also leads to an increased venous return, further stressing the heart and leading to backward failure. So you'll get right heart, left heart failure on this. Central arterial gas embolus. Patient attempts to rapidly ascend without exhalation. and nitrogen bubble is created and passes into the arterial circulation. Pulmonary barotrauma. Lung volume decreases during descent, so as you go down, pressure increases and the volume of the lungs that were once this big now are this big. Secondary to compression. The pulmonary barotrauma damage is due to rapid expansion of the lungs during ascent. So it goes from this to this too rapidly and causes trauma to the lungs. Scuba divers are trained to ascend 10 meters per minute with 3 to 5 minute stops at 6 meters. Deeper dives require more frequent stops. There are dive tables that they have for this that tell you to stay at a certain level for a certain amount of time. Minor dive syndromes include ear squeeze, sinus squeeze, and tooth squeeze. And the ear squeeze, the feeling of fullness in the ear. And this would be because of expanding gases. It got compressed at the lower depth, and then whenever you come up to the surface, it expanded. Sinus squeeze, pressure within the sinuses. Tooth squeeze, air underneath the tooth filling leads to toothache or barodontalgia. History. Survey the scene. The type of water, was it fresh versus salt? The depth of the water, temperature of the water, and if there's any water contamination. Patient's cardiac history. Cold water immersion has been known to cause dysrhythmias. So if they've had a preconditioning history there, it could definitely throw them into a dysrhythmia. Activities preceding the accident. Were they indulging in alcohol or substance abuse? Common factors in over half of the drownings, and it can complicate the physical assessment. Witness description of the patient. Typically, patient is described as having his head above the water, struggling to stay afloat, and then quietly slipping under the water. And then submersion time. Usually calculated from the time the patient is last seen to the time of the rescue. Examination. Expect the patient to be resuscitatable. Focus on the level of consciousness. So an unconscious patient, focus on life signs. Unconscious but has a pulse, primarily zone in on their airway, but keep the rest of it open in case you have rapid changes. Conscious patients able to maintain their airway, auscultate the lungs. Rule out Cushing's triad, and that would be because of a underlying head injury. If they have got unresponsive due to a head injury, we would like to catch that as early as possible. So pulse oximetry, blood glucose, vital signs. Remember, Cushing's triad is hypertension, bradycardia, and then adjusted respiratory patterns. Assessment. Suspected drowning. Body is found. Typical signs of death may be misleading. Rigor mortis is stiffening of the muscles. Livor mortis is blood pooling, and allegor mortis is cooling of the body. Better indicator if we find somebody that's been drowned is maceration of the skin. White wrinkle skins of maceration starts peripherally at the toes and fingers in about 2 to 4 hours. Now, if they've been in the water all day, this could also throw us, they could have drowned 15 minutes ago. As far as the treatment, basic life support, critical to the patient's survival. Spinal precautions, even if they don't have trauma, we should just prepare, especially if we don't have a good historian. Chest compressions for the patient in cardiac arrest. Standard advanced life support, patient in cardiac arrest found in asystole. Airway and ventilation, patient not in cardiac arrest but is unconscious. Airway and ventilation, I just said that. Fluid resuscitation. Patient's intravascular volume should be optimized in order to dilute the acidosis and improve circulatory status for adequate cerebral perfusion. So as far as treatment goes, that means a fluid bolus. Passive external rewarming, remove all their wet garments. Take a core temperature. Remember, if they're hypothermic, and this would, if the water's cold, it could induce hypothermia. Just be aware that most of the waters are 77 degrees, and that hypothermia, we don't call them until they're warm. So passive, maybe even some more aggressive rewarming if it's colder water. Evaluation, accumulation of fluid in the lungs, evidenced by coarse crackles as well as dilution of surfactant leads to atelectasis. So we wash out all the surfactant and get some problems with that. Continuous positive airway pressure is advocated by some. Indications on this would be hypoxia, accessory muscle use, and auscultation of advantageous breath sounds. Endotracheal intubation is indicated. If we require to oxygenate them, positive end expiratory pressure or PEEP is also indicated for better control of ventilation. Gastric distension, common complication of resuscitation. Quickly place an orogastric or nasogastric tube. This will decrease the amount of gastric distension that's actually present. Indisposition, destination decision based on the level of consciousness. Unconscious hypothermic drowned patient. Take them to some place where they can do ECMO or extracorporeal membrane oxygenation. This looks promising, similar to heart and lung bypass machine. Survival of all drowning patients, somewhat unpredictable. They have something called an Orlowski score. And what the Orlowski score does is it gives us a prognostic indicator of survival. I'll read you through this here just a little bit. The Orlowski score is commonly used as a prognostic indicator of survival. A point is added for each of the following: age 3 or greater, submersion for greater than 5 minutes, resuscitation started after 10 minutes, and the patient being in coma on arrival to the emergency department, or having an initial arterial blood gas pH less than 7.1. If the patient has a score of 1 or 2, the patient has a 90% chance of recovery, whereas a score of 3 or more indicates that the chance of survival drops to about 5%. In conclusion, risk factors of drowning. Fact of life for parents, unfortunate. Most common accidental death cause, ages 1 to 14. The key is prevention, supervision when around water, 4-foot fence with latched self-closing gate, pool gates open in 70% of pool drownings.
If you have any questions concerning this topic, feel free to contact me. My name is Roy Smith, SmithArtSamaritanEMSOK.com or 405-492-8243. Thank you.